When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Good evening. Welcome to Dr. Go's show. Today we are talking about most commonly asked question, how do I optimize my child's growth? To talk about this topic, we have Dr. Shavi Agrawal. Welcome to Dr. Go's show.
Thank you so much for inviting me for this show.
You're most welcome. Dr. Agrawal did her training in India. Then she went to UK where she did her training in Royal College of Pediatrics. And then she came to State of New York and did her MD, and then she went on to do her MS and fellowship in pediatric endocrine. She's practicing in Bronx, New York. She has her practice, and you can see the website and telephone number. So what's a normal pediatric growth? When patients come to you, how do you define what's a growth?
So growth is one of the very fundamental characteristics of pediatric age group. As soon as the baby is born, the parents are watching excitedly how they're growing. So physical growth is basically the change in the height and the weight and the body shape as the child matures. So the hair growth, the teeth coming in, coming out, then coming back again, and the changes of puberty during adolescent year all are part and parcel of the growth process.
So it's an indirect way of telling that baby is healthy, everything is working, and everything is going according to the age and the culture, the background and ethnicity, all that plays in the role.
Absolutely. So there is no single point where we can say that this is normal and this is abnormal. The growth of the child is, as you rightly said, is interpreted in terms of what his genetics is, what stage of puberty he is, and what is his physical state in terms of activity, food, and how is he doing academically. So everything counts towards before saying whether the child is growing normally or not. There are no fixed numbers.
Correct. And that's why I think you guys have the growth charts, right? So when we bring babies and our kids to pediatrician's office, you measure the height, and when they're little, you measure the head circumference. So can you walk through why do you guys have growth charts? What's the importance of that?
So as you would have rightly said, and every time your child is taken for an annual visit, the height and weight is recorded on a growth chart. The growth chart is a means of for your doctor to know how your child is compared to the standard that is expected for your child's age, gender, and ethnicity. So every child's height and weight would be compared to the standard for that age group.
Correct.
So if your child is, say, on the 10th percentile on the curve, what does that mean? It means that your 10% of the children at this age and sex would be lower than the weight or height for your child, and 90% would be above your child's weight. It does not mean that it is abnormal. It just tells you where your child is in respect to the average weight of the kids of that age and sex.
Correct. And I think that's a very important point, because one number actually doesn't mean much. That's why you have a curve and a chart that you have to see. If somebody is static, even if it's 58th percentile, that's something bad. You want the baby to grow and move, even if it's 10th percentile, as far as there is continuous growth.
Absolutely.
Means baby is fine.
Right. So again, it's not the single point, but the track of the growth along the period of time. So when your doctor is seeing, he's seeing how is he growing, not only just the absolute height, but the growth velocity, which gives much more information to know whether the growth is normal or if there is any disease process affecting the growth.
Correct. Because we see also in obstetrics, while we do ultrasounds, when somebody is pregnant and we put the baby's weight, the fetus at that point, to see how the baby is growing. And most Asian babies tends to be smaller.
Right.
So always the moms come, oh my God, my baby's going to be small. Is there a problem? And I have to explain, no, as far as there's a growth, there's a good curve, your baby is doing fine. So that trend still continues outside the womb. And that's why, as far as there is a good pattern of growth, not just absolute number, that kind of makes sense.
And this growth velocity is different in different age groups. So your expectation for your child growth should be realistic. So in the first year of life, the child's growth is very rapid, so much so that they can gain up to 25 centimeters in length and triple their weight from birth.
Correct.
But then this growth slows down, and I often get referral from the parents because they are worried, now my child is not growing as much, but that's normal. Your child growth slows down, and from 3 years till your child hits the puberty, the growth is slow and steady in the range of 2 to 2.5 inches.
Right.
And only when they hit the puberty do you see the pubertal growth spurt, which is as much as 10 to 12 centimeters an year, and your pubertal period growth spurt can last from 2 to 5 years.
Correct.
So this is something that is followed on the growth curve, and this is something that you should be expecting when your child is going through different phases of childhood.
Correct. And I think the other important point is that a girl develops at a different rate than a
Right.
boy. And I think that, sometimes the girls tend to shoot up earlier than the boy, and then the boys' moms they're like, why my son is shorter, what's going to happen? But boys tend to have a little bit delay, right, in the growth spurt and
yes,
the puberty.
so the girls most of the time would start their puberty much earlier, around 8 to 13 years, compared to boys who normally show their pubertal growth spurt between 10 to 15 years of age.
Correct.
So they start later and then they keep growing for a longer period of time, and it's very commonly seen, oh, the girl is getting taller while my boy is still not
Looks
growing.
younger,
So this is because the pubertal growth spurt comes at different times. And also the pubertal growth spurts also depends upon the family history. So very, very important. I often get referrals because the kid is a little distressed because all his classmates have started the puberty and they're taller. And so it's very important to talk to them and convey that he could be a late bloomer, especially if there's a family history, and that he would ultimately be able to reach his peers' height or the family height. It's just that his puberty might be starting a little later.
Right. And I think it's the same questions we get asked also, why my friends are having their periods and why I'm not getting my periods, or why they have, developmental wise they are ahead with hair and breast development. And I often tell them, ask your mom, what age did she undergo? That's kind of the pattern you're going to follow.
I agree. I totally agree.
And so a very important point here, that the normal growth is different for a girl and a boy. It's not an absolute number. It's a chart that one has to follow, and let your doctor decide, because as far as there is some growth, even if the number might be lower, but there might be different factors which affects the growth. So when does a pediatrician get worried and refer you the patient, or when does a mom, who's worried, will ask a pediatrician that maybe I should see a specialist? What are those causes?
Right. So again, the most important message is that most of the children who are short are normal. They may be short because they are coming from a short family, or they may be short because they are late bloomers. So these are just the normal physiological variation of growth, and these are completely healthy kids who otherwise are doing fine, eating well, sleeping well, physically active. They do not have any diseases or any issues that needs to be treated.
Correct.
But yes, your pediatrician might get worried if he sees that your child is plotting well below the expected weight or height for your child, which is in our term is set 2 standard deviation, which in other literal terms means at least 10 to 12 centimeter below what could be expected. And the most important again is the growth velocity. So in a childhood, the child who's between 3 years to puberty, if he's not growing or if he's growing less than 2 inches, then that could be a sign of worry. Or if you look at the growth curve, if the child's growth curve is crossing the percentile and going down the curve, that could be a state of worry. So these are some of the things that, or if your pediatrician finds that there is a very poor gain in weight as well as a height, and he finds some physical stigmata like that links toward the genetic syndromes, then also he might be worried and he might like to refer to the specialist, the pediatric endocrinologist, for further evaluation.
Somebody has come to you, they have referred either the parents or the pediatrician. What are the ways that you kind of work this patient up? What are the investigation? What history? Infections? I think you guys start from the pregnancy, what happened in intrauterine. So what's kind of a workup for this patient now?
So whenever we see the patients in our clinic, the most important thing that we start with is getting some idea about the family and the patient. So how was what was the mother's health during pregnancy? Was she on any medications? Was there any in utero event that could have affected the growth of the fetus? Were there any indication of poor fetal growth during pregnancy? Then the next important thing is, what was the weight of the child? Some of the kids who are born extremely small
or premature
may not grow to their actual potential and can be helped. And then again, is there any indication of the child having some other sicknesses, like any bowel problems leading to malabsorptions, kidney problems leading to not making the child not grow, heart conditions or lung conditions, chronic asthma, uncontrolled diabetes. So these are the histories that would help us to decide what could be affecting the growth of the child. Then the other important thing is to take the family history. What are the heights of the parents? What are the height of the siblings? When did the puberty start in the family members? So those will also help us to decide what expectations to have for the child. And if we do find that the child is really short, and then we review the growth curves, especially most of the time the pediatricians are nice enough to send us the growth curve, and we get an idea about how the growth velocity has been of the child for a couple of years, or at least couple of months before the child was referred. And when we do find that the child is either extremely short, or his growth velocity is very poor, or his the other thing that most of us do is an x-ray of the hand to see the bone ages and see how the bones or the skeletal is maturing in terms of your actual chronological age. And if we see that they're severely delayed, then these are the kids we might investigate for some hormonal problems, or do the test if the evaluation sees that there are certain diseases that we need to
so your investigation will kind of drift you towards one diagnosis, and you might do some more diagnosis, either the metabolic wise or hormonal wise, to make sure you come to a conclusion. Sometimes you might have to take a biopsy of certain organs to figure that out. Is there something, before we go into detailed discussion about once you diagnose somebody with a disorder, is there something parents can do? You know, there was a recent article last week which published, said that if you drank 2 glasses per day of milk, your height potential is going to be significant. Is there any value to such studies? Is something parents can do? You know, we used to tell the kids to kind of hang up and, you know, exercise. Is there any value in those things?
The parents can play a very important role in optimizing their children's growth. So again, although there are multiple factors that affect child growth, but the fact that you can really make a difference is through nutrition. So the growing child should get a well-balanced diet rich in minerals and vitamins. And if you can give your child a well-balanced diet, you will definitely be helping your child achieve his or her genetic potential. The other thing is the growing body needs rest. So the sleep is extremely important. So all the growing children should get at least 8 to 10 hours of sleep. Although I know and I see this common complaint that the middle schoolers and high schoolers are sleeping late, getting early, but it can definitely affect their health. So it's the parents' responsibility to make sure that the kids are going on time, and when they go to bed, there are no more distractions. There shouldn't be any TV or loud music or any computers that are on. So whenever they're sleeping, they should get a restful sound sleep. And the third most important, physical activity. Nowadays, most of our kids are spending too much time in front of TV or computer games, video games and iPhones, and so they are really not getting the physical activity. So physical activity is not only necessary for them to maintain a healthy weight, but it can also affect certain hormone secretions. So your body secretes growth hormone when you're sleeping at night, your body secretes growth hormone in response to your exercise, and there's so many other hormones that can be affected with the physical activity.
And also benefit to your bones and your health.
And definitely the healthy bones are part of the physical activity. So I would say, if you want your child to you want to help your child, try to look at the diet, look at their sleep pattern, motivate them to go for any form of physical activity that they like to do, so that they can optimize their growth.
So we've talked about so far about what are the normal growth, what are the causes of sometimes delay, and how do we investigate somebody, and what are the small, things that we as a parent can do, make sure they get enough sleep, enough nutrition, enough rest and activity. Most of you will have questions about the growth hormones, and we're going to take a short break and come back and see how we can optimize or make them a little bit taller. We'll be right back.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.
Welcome back. Today we're talking about pediatric growth and what are the common questions. I think in our community we're always worried about that our kids are going to be a little bit shorter, and how do we optimize. So far we've discussed about nutrition, good diet, good rest, exercise, common causes of short stature, chronic conditions, metabolic syndrome, and chromosomal issues. Dr. Agrawal, now you've diagnosed somebody. We'll talk about only short stature today. Mm-hmm. You've diagnosed a kid that, yes, maybe he's, in the height-wise, he's not optimized. How do you go about, treating them? And, most of us know about growth hormone. What's a growth hormone?
So growth hormone is a protein that is secreted by a gland called the pituitary, which is situated at the base of the in the base of the brain. And it's responsible for secretion of a lot of hormones, and one of them is growth hormone. And the growth hormone major action is improving your linear growth, although it can also have some metabolic effect and effect on your body composition. So we have been using growth hormone for more than 20 years now. So it's been used only but for certain conditions, and only in a very small proportion of kids who actually need growth hormone. Because either they are deficient or there are other approved indications for use of growth hormone.
Right. So what are the common indications when you'll say, yes, this pediatric patient will benefit from it?
So first of all, we try to prove that the child either has a growth hormone deficiency is one of the biggest indication for growth hormone use in pediatric population. So there are certain clues that we get in the history or examination which tell us that the child might be growth hormone deficient. Okay. So most of these kids start falling off on the growth curves. They start crossing off their centiles. Their absolute height would be much below the 2 standard deviation. Their growth velocity is less than 2 inches during their childhood years. When we look, we can calculate the genetic potential of a child by taking into consideration the parent's height, and we can calculate the approximate predicted height on the basis of the bone's maturation. So when we see that the child's predicted height is much below the genetic potential of the child, that could also be an indication that he might be growth hormone deficient. And then if the bones are far behind their actual age, and they have no other diseases that can account for that, then these are the kids we might like to investigate for growth hormone deficiencies, and we do a special test which is called a growth hormone stimulation test, where the child receives a medicine which stimulates the pituitary to secrete growth hormone, and then we get series of bloods to measure the growth hormone. On the basis of that, if we do find that the body is not making enough growth hormone, these are the kids who can really benefit from growth hormone therapy, and we try to start them as soon as the diagnosis is made. And for growth hormone deficiency, most of the insurances will pay for the treatment. And growth hormone is given like a daily injection, and you give it for a couple of years depending at what age the growth hormone started. Besides the growth hormone deficiency, there are certain other indications where we would use growth hormone. One is a genetic condition called Turner syndrome, which is very commonly seen in short girls with short stature. So in our practice, any short girl that walks in our clinic is investigated for Turner, because some of them might not even have any physical stigmata.
Like the web neck.
Right. So most of them have very small genetic abnormality, and they might not have the physical signs, and they can get missed. So it's very important because you can improve their height if you start growth hormone early. Again, there are other certain genetic conditions like Prader-Willi syndrome where you can give, and it helps improve their muscle strength and body composition. Then there are kids who are born extremely small, and most of these kids who are born extremely small and their weight is much far below their expected for the gestational age, called the SGA babies, they will initially show a catch up, and most of them would be able to reach or catch up on the growth in the first 2 years of life. But if they do not do it, then these are the kids who might end up short, and you may give some growth hormone to help these kids.
So what's the prevalence of use of growth hormones? Like, how many kids in USA get that?
So approximately 20 to 30,000 kids in US are receiving growth hormone, and almost 4,000 kids per year have clinical indications for growth hormone use.
So you think there's more abuse of growth hormones going if 4,000 are needed and 5 times more are receiving?
These are the total numbers that are receiving. Eligible kids are about 4,000 per year. Definitely their expectations are higher, but most of the time there are limited there indications approved by the FDA, and none of the physicians would like to prescribe growth hormone out of those framework because it can lead to legislative consequences.
Right.
So
what are the pros and cons of using it? Why not use it? Why not make everybody a little bit taller?
Right.
So what's the disadvantage of using then?
So again, like any other medicine, growth hormone also has potential complications. The first thing, the most important thing is if your child does not have a growth hormone deficiency, if your child has a genetic potential to be short, these are the kids who, even if you give growth hormone, might not benefit from growth hormone.
Right.
Plus, if you do give growth hormone, there are certain risks and complications which you have to monitor while the child is on growth hormone treatment. Approximately 3% of the kids who are treated with growth hormone can develop these side effects. One of the most important one is the kids can start having headaches, and this happens because there can be slight increase in pressure in the brain. So these are the things you have to monitor. The child can start limping or complaining of hip and knee pain that can happen because of the sudden growth in the bones. Some of the kids you might have noticed have a slight curvature in the spine, which is more noticeable during the pubertal growth spurt. And when you give growth hormone, that can increase. So you have to watch for scoliosis in these kids. Some of the kids may have propensity to develop or maybe at higher risk for developing type 2 diabetes. So if you give growth hormone, because growth hormone will increase insulin resistance, you might increase their risk for type 2 diabetes. So you have to monitor them from insulin and glucose levels.
Right.
So these are some of the risks that you have to weigh, and then it's like a daily
It has to be monitored.
It has to be monitored very closely if the child is on growth hormone.
Correct. Now, what is the research saying that? What's the latest research about growth hormone? There's anything in the horizon that you can shed light?
So people are learning more and more about growth hormone, and they are now understanding that besides the linear growth, the growth hormone also has anti-inflammatory and immunological properties. So growth hormone has now been tried in other conditions beside growth hormone deficiencies like inflammatory bowel disease, children with cystic fibrosis, children with rheumatoid arthritis, or children who are on long courses of steroids. So they have been trying to see if growth hormone can benefit. So I'm thinking that the use of growth hormone would increase in future because there'll be more diseases where you might be able to help with the growth hormone.
Right. Now, typically at what age do you guys start, the children on growth hormones?
So there is no specific age. It depends upon the cause of the growth hormone deficiency. So you can have growth hormone deficiency because your pituitary didn't develop or had a structural abnormality, or you can develop growth hormone deficiency later on in life because of trauma or infection or tumor. So the thing that would guide you would be following the growth chart and physical examination and monitoring of the growth. But the most important thing that I would say is the earlier the diagnosis is made and earlier the growth hormone is started, the better the potential of the child to reach his or her height potential.
Before the plates fuse.
Before the plates fuse.
So
Once the
is
child,
there an upper limit to when you can give then?
so it depends upon the age of the puberty. So most of the time, the girls by the age of 15 and boys by the age of 17 have finished their pubertal growth spurt and their bones have fused. So it's very unlikely that they would benefit from growth hormone, except for exceptional cases where the puberty might have been really delayed or something.
But ideally, once the growth plate has fused, there's very
unlikely that the growth hormone
just
will
with the
make
growth. I think there are orthopedic procedures some people have developed to potentiate the growth at that point. But hormone-wise, we are done. Is there a monitoring of the growth hormone? Is there a legislative rules in the state of New York?
So the growth hormone is controlled by the FDA. It's an FDA-approved medication. So there are specific guidelines for whom you can prescribe growth hormone, and the growth hormone can only be prescribed by the pediatric endocrinologist or the nephrologist.
Okay.
So if the supervising physician prescribes growth hormone outside that framework of indications that the FDA has approved, then it can lead to legislative consequences. So you have to be very careful for what reason you are prescribing and who is prescribing the medication.
Thank you so much for coming and giving us this informative talk. I'm pretty sure all the viewers at home will benefit from this talk. Today's talk was about optimizing our child's growth. What can we do? How can we avoid? So most important thing is keep a lookout. Ask question to your pediatrician. If you have doubt, if everybody in your family is tall and your child is not growing as much, maybe look into different causes and maybe ask for a specialist to investigate. And if diagnosed at the right time for the right cause, I think there's treatment available. You can definitely see this show on YouTube and it will be aired again. And you have any question, your friends have question, you can always go and see Dr. Agrawal in Bronx, New York. Thank you so much. See you next time.
When your family's in need of medical care, where should you turn? Come to Englewood Hospital, home of the most advanced technologies and medical equipment. Home to Magnet Award-winning nurses who deliver compassionate professional care. And home to more top-rated doctors than any other hospital in North Jersey. For your family's health, come to Englewood Hospital. We're closer than you think.